Heart attack symptoms alone? Do this to survive. Imagine this. You are sleeping soundly in the middle of the night in the quiet room you call home. Suddenly, a strange pain wakes you up. At first, it's just a heaviness in the center of your chest, but gradually, it feels as if someone is squeezing your heart with both hands. You sit up abruptly, breathing hard, cold sweat running down the back of your neck, your heart pounding like it's about to burst out of your chest. There's no one there, no family, no phone within reach, just you and your fear. In that moment, what would you do? Who would you call? Should you wait and see if it passes? Or could this be the very last moment of your life? I'm a cardiologist, and I have met hundreds of patients who described exactly this scene. Many survived, but some did not. One thing still haunts me. Most of them had no idea that the pain they felt was a clear sign of a heart attack until it was too late. So how can you, if one day you find yourself in that situation, recognize the warning, take the right action, and save your own life, even when no one is there to help? To answer that, you need to start with the most basic question. Can you recognize the 7 signs that are often overlooked but are actually the earliest warnings of an approaching heart attack? Don't look away. Sign number 4 will startle you because you may have experienced it without even realizing.
7 heart attack symptoms. Do not ignore. You may have felt tired after a long day and told yourself, it's probably indigestion, or it's just mild discomfort. But many people only realize they've survived a heart attack after waking up in the hospital. Why? Because they ignored the most important signals their body was sending. The most common, and also the most easily mistaken symptom, is chest pain. It's not always the dramatic crushing pain you see in movies. Sometimes it's a heavy, squeezing sensation, as if someone is pressing an entire bag of cement on the center of your chest. It doesn't pass quickly like the bloating discomfort from gas. It lingers, weighs heavily, and sometimes radiates to your left arm, jaw, or back. But have you ever felt this kind of pain and quietly brushed it off? Another often overlooked symptom is unusual cold sweats. Not the kind from heat, but the kind that makes your spine feel icy cold even when you don't have a fever. In a state of biological panic, your body releases adrenaline, which constricts your blood vessels, making you feel chilled, your skin pale. Have you ever woken up at 2 a.m., your shirt drenched in sweat without knowing why? If you have ever felt nausea or the urge to vomit without a clear reason, especially when combined with fatigue or deep discomfort in your chest, don't assume it's just your stomach. This is particularly true for women, people with diabetes, and older adults. Heart attacks in these groups may not cause chest pain at all, but instead show up with this symptom alone. Are you taking insulin or diuretics? If so, these episodes of nausea can be even more dangerous than you think. Another warning sign is unusual shortness of breath, a feeling that no matter how much you inhale, it's never enough. During a heart attack, the heart is unable to pump blood effectively, causing fluid to back up into the lungs, which leaves you gasping for air. That sudden suffocating feeling in the middle of the night that forces you to sit upright? Have you ever experienced it and simply blamed it on getting older? Numbness or heaviness in the left arm or even both arms is also a signal many people ignore. The nervous system can't clearly distinguish between pain from the heart and the arms, so when your heart is in distress, you may actually feel it in your arms. Have you ever thought, I must have slept on my side too long and my arm went numb? But if that numbness comes with fatigue and a pounding heartbeat, it might be far more than just a bad sleeping position. One of the most easily overlooked symptoms is a sudden, intense sense of anxiety, as if you are waiting for something terrible to happen. Many people describe it as, I don't know why, but I felt an overwhelming sense of dread, like something was about to kill me. And sometimes that is exactly what's happening. Have you ever woken up with an unexplainable restlessness, only for things to take a sudden turn for the worse minutes later? And finally, but no less important, is dizziness, or a feeling that you are about to faint. Especially in older adults or women, this can be the only symptom. A drop in blood pressure, arrhythmia, or loss of blood flow to the brain, any of these can happen within a single minute. If you've ever had to sit down in the middle of a walk because you felt lightheaded, could it be that you narrowly avoided a major heart attack? So if you've just realized you've experienced 1, 2, or even 3 of these symptoms before, what will happen if they return one night? Do you know the very first thing you need to do to keep yourself alive?
Why calling emergency services is the first thing you must do. I had a patient named George, 68 years old, living alone after his wife passed away. He told me that one night, after feeling his chest tighten, he thought, I probably just need to rest for a while. But the feeling didn't go away. Instead, it spread to his left arm, then his neck. George tried to drive himself to the hospital, and just as he was turning into the parking lot, he lost consciousness behind the wheel. Fortunately, a security guard saw the car stopped in the middle of the road and called emergency services in time. If George had been just 3 minutes later, there might have been no one left to tell the story. I share this because George's case is not rare. 50% of all deaths from heart attacks occur within the first hour, when patients are still hesitating, reassuring themselves, or trying to manage the situation on their own. The question is, why call emergency services instead of just driving yourself to the hospital to get there faster? Because when you call 192 or your insurance's emergency response system, you're not just calling for a vehicle. You're calling for a trained medical team equipped to intervene immediately if your condition worsens en route. They have medication, a defibrillator, and the experience to act within seconds, things you simply cannot have if you are behind the wheel and lose consciousness halfway there. I know some people will object, but ambulances in my area are slow. Even if you believe it will take too long, you should still call. And at the same time, ask a family member, neighbor, or even a ride service like Uber to get you to the nearest hospital. The key is this: do not drive yourself. Why? Because at that moment, your heart is fighting between life and death. A single sudden arrhythmia could make you collapse at the wheel, and no one would know where you are to help you. If you're thinking, but what if I call an ambulance and it turns out not to be a heart attack? That would be a waste of time. Remember this: misjudging the situation is far worse than sounding a false alarm. If it is a heart attack and you lose even a few minutes, the consequences may be more than just a scar on your heart. They could be permanent. That's why when a heart attack strikes, calling emergency services is the first lifeline. But have you ever heard the advice, if you're having a heart attack, cough as hard as you can to save yourself? There are countless tips circulating online. The question is, do they really save you, or could they make things worse?
Dangerous mistakes many people make. Have you heard this tip? When you feel chest pain, cough hard and continuously to keep your heart beating. On social media, videos like this have millions of views. People call it cough CPR, performing chest compressions by coughing. It sounds reasonable, doesn't it? But real medical science says otherwise. This is one of the most dangerous misconceptions. During a heart attack, your heart has not stopped beating. It's injured but still working. CPR, chest compressions, is only done when the heart has stopped completely, meaning you are already unconscious, not breathing, and have no pulse. At that point, someone else must perform CPR on you. You cannot cough your heart back to life by yourself. I once had a patient, a retired truck driver, who coughed so violently in his bedroom that his daughter ran in, terrified. But he was still in pain, still struggling to breathe, and the heart attack was still underway. Because coughing does nothing to remove the blood clot blocking the coronary artery. Are you certain you wouldn't try coughing instead of calling for help if chest pain struck you in the middle of the night? Another common mistake is using vasodilator drugs like Isodil or Sustrate, without a doctor's prescription. Some people take pills left over from family members, thinking, if it makes me feel better, it's fine. But did you know that if you have recently taken drugs like Viagra or Cialis, or if you're experiencing a right ventricular heart attack, these vasodilators can cause your blood pressure to drop to a fatal level? There are also those who quickly take magnesium, having heard it's good for the heart. And while magnesium can help prevent cramps and mild arrhythmias, during an actual heart attack, it cannot unblock an artery and cannot replace aspirin or urgent medical intervention. I understand that when panic sets in, you'll cling to anything that seems like it might help. But those so-called little tricks can actually rob you of your only real chance at survival. So, if you shouldn't cough hard or self-medicate, what should you do if you're alone and you feel a heart attack coming on? What's the right thing to do in those crucial minutes while waiting for help to arrive?
If you're having a heart attack and alone, do this. You feel chest pain, your breathing is fast and shallow, and your heart is pounding like it's about to leap out of your chest. No one is there. A single thought flashes in your mind. I won't survive if I waste time. You're right, but you still have a chance if you act correctly right now. First, call emergency services immediately. Dial 192. Even if you think you can hold out for a few more minutes, don't wait. Call first, everything else comes second. You're not just making a phone call, you're activating a life-saving system. If no one answers or the ambulance is delayed, immediately call a neighbor, the closest family member, or book a ride to the hospital. But under no circumstances should you drive yourself. You could collapse behind the wheel without warning. Second, if you have time, unlock your front door, keep your phone close, and if you have pets, secure them so they don't interfere with paramedics when they arrive. I've witnessed a loyal dog unintentionally delay emergency care by a critical 5 minutes. Third, if you're not allergic to aspirin, chew 2 to 3 low-dose baby aspirin tablets, 81 to 100 milligrams, if available. Chew, don't swallow, so the medicine can absorb quickly through your mouth. This isn't a folk remedy, it's one of the very first steps in global heart attack treatment protocols. It helps stop the blood clot from growing and keeps blood flowing at least until medical intervention is possible. Fourth, sit down or lie on your side with your head slightly elevated, leaning securely against a wall, bed, or anything that will keep you from falling if you lose consciousness. Breathe steadily. Don't try to do anything else. Every movement forces your heart to work harder and could make your condition worse. Fifth, calm yourself by any means you can. Look out the window, close your eyes and imagine a safe place, because adrenaline and panic can trigger a dangerous drop in blood pressure or an arrhythmia. Keep reminding yourself, help is on the way. I am in control of this moment. It may sound like a lot, but in reality, all of these steps take less than 2 minutes, and those 2 minutes could decide your fate. I have a patient who survived simply because he kept his medication in the pocket of his pajamas and had the emergency number saved and ready to dial on his phone. What about you? Have you prepared yourself ahead of time? But what if it's not you having the heart attack? What if a loved one collapses in front of you, not breathing, unresponsive? Would you know what to do?
If someone else collapses, what to do? You walk into the room and see your husband, your partner of 40 years, lying on the floor. He's not moving, his eyes are closed, his lips are pale. You call his name, gently shake him, but there's no response. This is the moment many people have described to me later, in a trembling voice, full of regret. I didn't know what to do. But you will know. Immediately call emergency services, dial 192, put the phone on speaker and keep it nearby. Then, check if he's breathing. Look to see if his chest is rising. Lean in to listen for breath. If there's no breathing, no pulse, that means cardiac arrest. And now, time isn't measured in minutes, but in seconds.
Begin chest compressions. Place both hands in the center of the chest and press down hard, about 5 centimeters deep at a rate of 100 to 120 compressions per minute. You don't need to give rescue breaths if you're not trained. Just keep pressing without stopping until the ambulance arrives. That is the only thing keeping blood flowing to the brain and keeping the person you love alive. I once saw a 70-year-old woman keep her husband alive using nothing but her hands and her courage. And you, if it happened tomorrow, would you be ready? Even if you survive a heart attack, can you be sure your heart won't suffer long-term damage? What will truly help you recover and live well after such a crisis? Do you remember that feeling at the very beginning? The dark room, alone, chest tightening, heart pounding wildly, and you didn't know what to do. Now you have the answer. No more panic, no more relying on dangerous tips or waiting for fate. Now you can face the pain head-on and say, I know exactly what to do to survive. Never underestimate any symptom. Your body always speaks before it's too late. You just need to learn how to listen. A heart attack isn't always dramatic, but it is always urgent. And now you know every step to save yourself. That's a power many people don't have until it's too late. If you've ever experienced chest pain that jolted you awake in the middle of the night, or if you've ever watched someone collapse in front of you and felt helpless, then please don't keep this to yourself. Share this video with your son, daughter, spouse, neighbor, because you could be the one to give someone else a chance to live just with the press of a button. And if you've survived a heart attack yourself, leave a comment. Share your story. You never know, your words might help someone else get through the most critical moment of their life. I'm a cardiologist, and if you're still listening at this point, I want to tell you this: you've just saved yourself. And who knows, you might also save someone else.